the ICU capacity is now at its limit. What we call the certified beds, which are the beds that have been visited by the certification commission of our society, are all full. But of course, we have beds in reserve because all the hospitals have been able to increase this capacity by asking more from them teams, and by asking people who normally are not working in the ICU to come and join the team. So we still have around 250 ICU beds in reserve, but the situation nevertheless is critical.
And how much concern is that causing you?
I think that for this patient, this very severe patient with an infection, COVID infection, the quality of care is an essential part to give them the best chance to survive. So you have to be taken in charge by teams that are trained, experienced. And when you are at the limit, the danger that you cannot be taken in charge by experienced people is higher. At the moment, the quality is guaranteed in Switzerland, but it was important for a society just to mention to people that we may reach a certain limit. And so to make them responsible regarding their behavior and to try to decrease the infection rate.
From your perspective, working inside a hospital, do you see a disconnect with what's happening on the wards from the attitude of the public outside?
Yeah, but I think it's normal. Of course, if you are living in this reality, our reality now in the ICU, or if you are outside, you cannot have this perception of how severe the situation is. And we don't want to make people afraid. We just want to make them responsible and understand. But of course, there is this kind of misperception of what it is. And we hear that all these people who are in the ICU are old people, or it's almost normal if they die, which is not the case. Of course, I think that if the people would see what is happening in the ICUs, then they will understand.